So once again, you guys are tuned into Saki Sizwe. That was Texas Hold'em by Beyonce. And lucky us today, we have a very interesting interview. So, of course, we're addressing human rights today. And specifically, we're addressing the human right of access to healthcare services. Organ transplantation is a critical area of healthcare that is vital in saving lives. Unfortunately, the global reality for many people in need of life-saving organ donation is spending years on a waiting list due to organ shortages. One factor that exacerbates the issue of organ shortages is a lack of space and equipment to maintain the viability of donated organs. A group of students from Stellenbosch University is working on the LifePod project to forge that space. Saki Sizwe has the privilege of speaking with 3 representatives of the project to tell us more about what they're doing and how they can support. So how are you guys today?
We're doing well. Thanks, and yourself?
I'm doing very well. Do you want to give a short introduction of yourselves, just your names? Yeah.
Okay, my name is Moaz Ibrahim. I am one of the general managers of the UCT branch, which recently opened up about last year. And along with me is Hana Nahdi, and she'll introduce herself as well.
I'm Hana. I'm the other general manager of the UCT branch of Save 7 as well.
Hi, my name is Matipa, and I'm the Chief Growth Officer.
I just need you to speak into the mic.
Sorry. My name is Matipa Ledoga, and I'm the Chief Growth Officer at Save 7, so Head of Media.
Wonderful. So can you guys elaborate on the concept of the LifePod and how it will revolutionize posthumous organ donation?
So for one, what the LifePod is doing is it's a donor ICU bed which is able to have patients come in and be held for about 12 to 36 hours so that they can be prepped for the surgery for organ donors. Mm-hmm. So this will aid in more referrals and more successful transplants happening.
Wow, that's so interesting. What motivated you all to initiate the establishment of the LifePod?
So what initiated the establishment is that Tygerberg Hospital's transplant unit isn't as big as it has only kidney transplants basically. Mm-hmm. And to get the ICU unit is placed right next to one of the transplant units. So it's more efficient to refer donors to the hospital. So it'll just basically increase donor rates in the Tygerberg Hospital and hopefully save more lives.
Wow, thank you so much. And so, could you guys share any specific examples or stories that highlight the urgent need for improved organ donation infrastructure?
So I can tell you about what's happening at Tygerberg at the moment.
Mm-hmm.
So there's about 100 organs that have been lost each
Oh, wow.
year.
Okay.
And there's many people that are waiting for kidney transplantation, for just organs coming from these facilities. So that means that at least there will be potential kidney loss. And there'll be like about 2%. There's like 2% of our population, right?
Mm-hmm.
And that 2% of our population, basically, they need organs, and those organs are being lost to that. So the LifePod, basically, what it does is that we are basically securing a theatre that will be it's specialized to have transplantation processes being happening in there, so the surgery itself. So what it helped us with is basically securing the organs for at least 24 hours, so that when the organ donation process can be facilitated by the doctors and the nurses in the institution.
That relates to a question that I'm curious about, like how it relates to like the timing of like organ transplants, like. So how does the LifePod address the critical issue of like timing alignment between the availability of organs and transplant opportunities?
So the first thing I think we should all understand about transplantation is the accessibility to the information about it.
Mm-hmm.
So in my department, we do that by making sure that people have access to information about organ transplantation. So we also have an AI-powered chatbot where people can ask questions in different languages, seeing that we are a Rimba nation. And another thing is that we basically use social media to basically spread that information. We taking information that we get get from our social media analytics, which is basically people's behaviors, what they consume on social media, and we basically use that information to make personalized content for them. And that helps us understand how South Africa thinks in general and what they would like to see on social media. So accessibility to that information makes it even better. And having that accessibility also includes that we also have the power to have the website as well. But for that website, we need funds for that to keep it running as well. I guess they can say about the nitty-gritty stuff.
And one of the other things that is essential to know about organ donation is that there's a very specific time-sensitive window for the opportunity to have organs that are viable. And this LifePod, this ICU bed, is used so that we are able to keep organ donors ready for the surgery that is to take place, to aid in adherence to the various to the surgery that is to take place.
Yeah. That's so interesting. So, I'm curious about so we're talking about the specific. Okay, you were talking about how the role that social media plays. Why is it important for you guys to have a presence on social media and to have your website up? What does that help? How does that push forward your project?
Yeah. So at the moment, we have a goal to reach 1 million people. And basically, people donating and people seeing us on social media and on our website will help us raise awareness about organ donation, will help us raise awareness about people awaiting organs. So the donation money usually is used to keep our site running. It also helps for meals for the patient, for our support groups. It also helps for new innovations that need to be implemented so that we can continue raising awareness. And also it's helping with the LifePod. So currently we need about 400K for the LifePod to be initiated. And that money will basically help the LifePod of Save 7 to become a dream come true for us.
So regarding the LifePod, so the one campaign that we've done is the Try for Life campaign. So that was a campaign in which athletes ran the Ironman to raise awareness about the LifePod. And through that, we've had amazing responses from donors and amazing generosity from people to save lives through this LifePod. And we've reached just short of 200,000 Rand. So it's fantastic, absolutely fantastic. We've really had amazing. Thank you so much. It's really amazing that we've seen so much generosity from people about this LifePod, and hopefully we can reach 400,000. Hopefully.
And I do have a question. So, what role does the Health Foundation play in supporting your fundraising efforts for the LifePod? And why do you think you've gotten external support for this initiative specifically?
So with every rand that you donate, every rand that you donate to us, the Health Foundation is going to double it.
Oh, wow,
so
that's amazing.
It's really great that the Health Foundation is going to double every single rand we make. So that's the role the Health Foundation plays. And I think that people it's through our also social media, we've really, especially with the youth, so we've really gotten in contact with the youth as well, and they've seen the need to save lives through just even becoming an organ donor, or even just raising awareness about it. So I think people really do see the need that you can just do a simple act, even just donating 1 rand will just get doubled to really save a life. So
And you can save 7 lives by telling your family, and they'll tell their friends and their other extended families. So it's about spreading the message, basically. So we are on TikTok, we are on Instagram and Facebook at Save 7 Lives, no spaces, 7 in words.
Can you actually tell me more about Save 7 Lives, and also about the name? Why is it called Save 7, stuff like that?
So Save 7 was named Save 7 because there's 7 life-saving organs that you can. There's 7 life-saving organs, and it was actually started up by Stellenbosch students, and myself and Anna became the first branch managers of the UCT branch, which started up last year. So I can tell you more about what we did from our point as a UCT branch. We started in August when there was the organ donor month, and we started up with our activation, and then we got approximately about 30 students, and we started up Save 7. then I think about this year we actually opened up, and now we have around 170 students. So it's just through basic, just getting media attention out, getting people to know, just spreading general awareness, and you can actually get quite a great backing, and people can learn about what organ donation is and what Save 7's about. So, yeah.
What sort of work do these student volunteers that you guys have been able to get access to do? What do they contribute to the project?
Just the project like Save 7 in general, or the LifePod?
If you have an answer about both, I mean.
So we've actually in the media team, we've actually done, we're doing like promotional videos for Save 7 in that way. In terms of in general, all the branches, we've got about 6 medical campus branches, if I'm correct.
3 non-medical.
Yeah, 3 non-medical as well.
So what they do usually in our social media department is that they do the editing, they take the content. Most of the time, they're basically the runners. If we have campus activations, we usually have a campus health day where we need people also on our station, so they help with that. They're actually a big part of Save 7. We are all volunteers. We're just like a big part of Save 7. So it's just about being a part of a good cause, which is Save 7, in paying it forward, doing something good and being part of something good. So
yeah, wow, that's so real. And it's also so good to know that there's students out here that are really invested in the idea of saving lives. People care. Yeah. And then how far along with the LifePod project are you, and what are some aspects that are preventing you from being able to bring it to its full fruition?
So regarding that, we actually got permissions from the hospital. We've got all the permissions. We've got the equipment list. The only thing that's stopping us is actually from starting up is the funds. So that's basically the only thing. So we just need the funds, and we can actually just start up the LifePod. And then after that, we just have to keep maintaining it, keep promoting the fact that you can save lives with this LifePod. And yeah.
Wow. Okay, great. Well, it seems that you were incredibly far along. And that it's really it's like this small last piece that's preventing you from really doing this thing that seems to have a great impact. And so, looking ahead, what are the long-term goals and aspirations for the LifePod project? And of course, how can our listeners support?
So for one, we hope that we can get a LifePod installed in all the hospitals throughout even the Western Cape, maybe even the whole of South Africa.
Wow.
And from that, we also have tried to implement an organ referral system, a better organ referral system. And even that, it launched provincially, and hopefully one day that will also be something that can aid in helping increase the organ donor rate. And so how people can help, that's the best part. We actually have a backup buddy system where you're able to donate and you can attach a little message as well. And if anyone, as long as you donate, even if it's R1, we'll have we have a
wall of fame.
Yeah. Yes. So your donations will always be remembered and will be going towards a good cause.
Good to know. See, if you listeners want to have your name on a wall of fame for doing something good, I mean, that shouldn't be the reason, but it's a little perk. But wow, so how can people, what are the contacts? How can people look it up, research the project, get to the page where they're ready to click the donate button?
So we have a website that's currently running, Save7.org. People can visit that page, and basically from there there's links to our social media accounts. There's also information about the LifePod and how you can become part of a greater cause.
Wonderful. So, thank you so much. So again, that is save7.org.
Yes. So Save7 as 7 as in the number .org.
Okay. So if you guys want to, I prompt you listeners, whoever's listening in, to go and donate. So thank you guys so much. We're wrapping up the interview, of course, now. But we're so happy that we got to speak to you today. This is such an important project. It's incredible how much work you guys have done on it so far. And it brings me personally hope to see that there's young students that are using their education while they're currently, it's empowering to see students that are like not only just like learning, but also using their learning to make a difference. Yeah. So thank you.
Thank you so much for having us.
Goodbye.